All right, talofa lava. Happy Samoan Language Week. This week I'm here at Parliament all week, including Thursday when Minister of Finance Grant Robertson, who's helpfully joined us for this pre-budget post-cab, when we will be delivering our first ever wellbeing budget on Thursday. On Wednesday, I will be joining Minister Clark to announce the government's response to the mental health inquiry. On Friday, I'm in Auckland for post-budget engagements. I wouldn't mind spending a little bit of time talking about the budget in the lead up to Thursday. As the Minister of Finance announced last week, we're meeting our budget responsibility rules in this year's budget, as we did last year. That includes meeting our debt target. This again demonstrates our spending parameters for this budget, of which a lot of investment has been shared over the past month as we've made announcements to tackle the long-term challenges facing New Zealand and, of course, to improve the wellbeing of all of us. We'll be putting more than 1,000 people who have been homeless into permanent homes where they'll get the support they need to not end up back on the street. We've made the largest investment ever to break the cycle of family and sexual violence and better support services. Māori and Pacific communities are receiving $12 million to fight rheumatic fever, an entirely preventable illness that is overrepresented in our Pacific and Māori communities and which can cause debilitating heart disease. We're focused on reducing the long-term challenges of the most serious offenders and breaking the cycle of reoffending and a life as a criminal to keep New Zealanders safe and bring down our prison population. We're putting thousands more teachers in our schools because we know we need to up the supply of teachers, so we're training and supporting 3,280 more. We're saving 145,000 families the $76.70 NCEA fee they pay for their kids at secondary school. Clean energy investments are being made to help us transition to a low-carbon future with a focus on our energy capital, Taranaki. And women are being supported with pay equity with $1 million to help the claims process and reduce barriers. And yesterday, of course, Minister Ardern announced a new service for young people leaving care, expected to help 3,000 young people and break the cycle of families in need of state care. These investments are ultimately, though, about getting ahead of the cost to all of us of not doing anything and not addressing the long-term challenges that we face as a nation. Instead, we asked that budget bids took a multi-agency, collaborative, joined-up approach. And of course, that they focus on our budget priorities. Now, last week, I took the opportunity to reiterate the 5 wellbeing budget priorities at a Business New Zealand event. And they include, of course, as many of you all know, taking mental health seriously, improving child wellbeing, supporting Māori and Pacifica aspirations and building a productive nation, and of course, transforming the economy. The wellbeing budget is about tackling New Zealand's long-term challenges, and I know that this is what New Zealanders want us to do. Any questions?
Mental health, will we get the full response on Wednesday? How will that play out?
Yeah, so as you will have seen for other reports that we've received, you'll get a response to the recommendations that have been made. But ultimately, in order to really get a sense of the government's full response, it will take those budget initiatives being announced alongside the response to the inquiry.
Able to announce it this week ahead of the budget, why not announce it back in January when it was planned?
Yeah, look, as we've said a number of times now, that ultimately the full response was going to take investment, and that was only ever able to be done through a budget process. It made sense to us to give people the whole picture by announcing in closer proximity to the budget when people would see that full mental health response.
So how much of the picture will we get on Wednesday?
So you'll see the response to individual recommendations, but of course, when it comes to service response, service changes, that's something you'll expect to see in the budget.
Why can't you give it at the same time on Wednesday, give the fiscal response, to give everyone the full picture at the same time?
Because it's part of our budget priorities. We've said that mental health will be a priority, and so it's part of the budget announcements. And so essentially it would be making it a pre-budget announcement. We could have made the decision to roll the inquiry onto budget day. Didn't want that to get lost, so we're doing it separately.
Yeah, it looks like a photo op ahead of the budget though, when you could have actually announced this back in January when first planned.
No, because of course, as I'm saying, Tova, then it would have been making a budget announcement that wasn't finished yet in January. We hadn't finalised the budget. We made it a budget priority. We know that there's a need for investment in mental health. New Zealanders have told us that. The inquiry helped us get a response from those who have used mental health services around what was missing. But of course, we aren't able to spend the money or invest until budget time comes around. So really it's about bringing those two issues together.
Announcing a suicide reduction target.
Again, that's part of what the inquiry called for, and we'll be providing a response to that on Wednesday. As I've always said, though, there are many competing views, both by those who have experienced suicide in their families, users of services, and those expressed by the inquiry. So it's one in which people have often taken different sides.
How many Kiwibuild houses will be built by June the 30th?
I couldn't give you a number specifically for June the 30th, but I know that we currently have nearly 400 under construction.
Will it be 300 by June the 30th?
Oh, look, I couldn't give you a completion date. Anyone who's built a house before will know the variability of completion dates, but I am advised that there are currently 400 under construction.
That's what the Minister said. And the 400, from what I understand, is by the end of this year. So by June 30, will there be 300?
And look, as I say, I just couldn't tell you that. I know that there are 400 currently under construction.
Another missed target?
No, we never had targets for those dates.
There was a target for those dates. That's the end of year one.
People asked about expectations of completion, but we hadn't set incremental targets in that way. There are 400 currently under construction. I can't tell you the exact completion date for those individual houses.
If you can't get 300 within the first year, how can anyone have any faith in that?
Again, as I've said, there are 400 currently under construction.
Just to clarify on mental health, how are you on Wednesday going to be able to say what you can and can't do if you're not going to be able to back that up with whether you've got the money to do it or not?
Of course, there were a range of recommendations. Not all were about service provision. There were a number of suggestions around the way that mental health is provided, the additional alternative courses of action for those who have had poor mental health experiences. There are a range of issues within the inquiry, and so it gives an initial response. And issues like, for instance, suicide targets and the like.
Would it be fair to say that the vast bulk would require some sort of resourcing?
That is correct, and that is exactly why we've always said it's best to have the inquiry response in close proximity to when we can give a fuller picture, which was always going to be the budget.
That just highlights my original point, is that how can you confirm anything if you don't have the ability to say what money's going into it?
Which, again, confirms why we always wanted the inquiry response to be in close proximity to the budget, which, again, I know that there was a desire to have the inquiry response come out sooner, but our view was that actually we needed the full package. We needed both the budget response and some of those other items, as have been raised, to be in closer proximity to each other.
Minister, on the,
December then?
You'll recall that I raised that when we announced that we would be doing it in close proximity to the budget for that very reason.
I think the Health Minister said in December that the government would be responding in February, March.
Yes. I can't recall the original timelines that were given, but it became very clear to us that the expectation was that if we put out a response that said ultimately this does require investment and that's coming in the budget, made more sense to have them together.
Prime Minister, on
Nothing's changed in that regard. That's always been the issue. Yes.
I was going to switch topics, sorry, but on the Lumsden Maternity Centre...
Feel free to throw any budget questions as well.
I'm
He's
enjoying
available
watching
at
this.
any
It's really
time.
interesting.
Yes, on Lumsden.
Yeah,
Yes.
do you think that it's acceptable that a baby had to be born on the side of the road?
And look, my understanding is that actually the mother in that case, who I'm glad is safe and well, was actually not on her way to Lumsden, that it wasn't her intent to have her baby at Lumsden. So keeping that in mind. Actually, some time ago, when I recall there being a discussion around maternity services in those areas where there were proposed changes, I had a look at some of those issues because, of course, one of the reasons that it was suggested that service provision change was because of the low numbers birthing at Lumsden. And I was interested in that. What had changed? Why were there low birthing numbers there? Because I was worried about access to service. One of the things that, if my memory serves, that I recall seeing was that at Lumsden, women aren't able to access a full service. And this is before any changes were made. So, for instance, epidurals weren't available. And so that may in part give some explanation as to why those numbers were decreasing. Perhaps also women wanting to make sure they had access in case anything went wrong to a wider range of services and care. So there were lots of things contributing to that decision.
Does it not highlight, though, a gap where women, particularly in more rural communities, don't have or don't feel like they have access?
And I think that that's probably those low birthing numbers at Lumsden were telling us that. And that was from the original case, before it was turned into a birthing centre, that actually those services there rurally weren't being provided. I do think we have to be mindful, though, of making sure that we try and provide in decent proximity full services, because I think that's why women were choosing to go elsewhere.
Minister
made a
has also
decision.
sent a letter to you. Is he right to be concerned?
But that's the point that I would make to him, is that women were making these decisions before changes were made to Lumsden. The numbers were low, and I looked into why, and my instinct is, having made some of those own decisions myself, would have been that probably women were possibly choosing to go to a place that had full service available to them. So it is something I was mindful of, and that's why I looked into it a little bit more.
Minister. Reinstatement of the full maternity centre in Lumsden?
Well, at this point, they didn't have full maternity services, in that sense, in the first place. And so that is one of the issues, why they had declining numbers. Look, in this particular case, this won't be the first time, of course, that we've had a woman giving birth in circumstances that aren't what she planned, and I'm just pleased she's safe. I'm happy again to have another look at the makeup of services, but actually what led to this decision in the first place was women making choices to go elsewhere.
Prime Minister, on the bullying and harassment report last week, are you aware of what the sexual or the serious sexual assaults were that the Speaker said were tantamount to rape?
They were anonymous and provided confidentially, and they should stay that way. No, I don't know detail around those complaints that were made within the report.
I interviewed the man who was stood down from Parliament, and he said that the serious sexual conduct that Trevor Mallard said he was responsible for, 3 cases of it, the most serious was, he said, a hug and a high five to a colleague. Do you think that's serious?
I'm not going to comment on that, Barry, because I simply cannot verify whether or not that's true or not. I just do not know the detail of the allegations.
Well, I can tell you it is true, because I've seen also the inquiry and the details of it that were carried out last year, and they said...
Have you seen the full details of the... My
question,
question, Barry, is, have you seen the full details?
I've seen the findings of the inquiry, and what the inquiry said, that the complaint...
What inquiry?
The inquiry that was carried out last year.
So not the detail of the Francis report?
I've seen, not that, but I've seen the inquiry. And they said that the complaint was unsubstantiated.
Again, you've asked me to comment on the Francis report, which had allegations within it that I have not seen the detail of, that were provided confidentially, and that were provided under that banner to ensure that those who were the victims felt able to come forward and speak openly to the inquirer. So I simply cannot comment on what you're stating, Barry.
Do you think the man...
Sorry, Audrey.
Do you think Trevor Mallard should have called him a rapist when Trevor Mallard didn't have the details either.
Again, I can't comment on what detail he was commenting on at that time. Of course, I assume it was the detail of the Francis report, and I simply do not know what the Speaker knows or does not know about the Francis report. That would be a question for him. But I expect that Francis report content may be different to what Barry's speaking about.
Do you think Debbie Francis should have spoken to the man who stood accused of these serious sexual assaults?
Of course, the report itself was not undertaking its own criminal investigation. It was a confidential report. It was up to the inquirer to set the parameters of how that was dealt with. My understanding is that, of course, victims are able to report to the police, but for many reasons may choose not to do so. That should never stop them from being able to speak confidentially to the inquiry.
Just on the budget responsibility rules,
Yes.
Finance Minister, and Prime Minister as well.
Oh, sure, but we might give him a chance.
Sure. Last week you said that you were going to shift your debt to a range rather than a target, and I was just wondering about some of the other budget responsibility rules, specifically the government's target of 30% of Crown spending in terms of GDP. Have you got any inkling to change that at this stage?
Before we move on to the wider budget responsibility rules, I will take the opportunity to reiterate that we met them last year, we're meeting them again this year. That includes the debt target. They run for a forecast period, so they take us out to 2022. Of course, projections are that we will continue to maintain our existing target of 20%, but in 2022, of course, the BRRs expire. Treasury made the recommendation that a band rather than a precise number was a better way to manage debt in those years beyond 2022. We've chosen a band where the midpoint happens to still be 20%. I see not everyone has grasped that continuity, so I just wanted to use, I'm not referring to anyone in this room by the way, so I just thought I would use the platform to again emphasise that fact.
In terms of the wider budget responsibility rules, we'll take another look at those. We're certainly going to be committed to the kind of fiscal discipline that we've seen, but clearly when we're producing a wellbeing budget, we hadn't done that when we set the original budget responsibility rules. That gives us the opportunity to think about whether the rules fully capture what we're trying to do there. So we will take another look at those, and clearly as we head towards election 2020, we'll be able to say a bit more about that.
The Prime Minister said that the debt range was assessed by Treasury. Did they have anything to say about the core Crown spending target?
Not particularly in that advice, no.
So what about your own perceptions as a party or as an executive?
Look, as I say, we remain committed to the concept of fiscal discipline, and part of that is around government spending. But we will take a look in the context of producing wellbeing budgets about what the appropriate set of rules are for that. But you can expect to continue to see guidance and rules that are about making sure that we are fiscally disciplined.
So there is scope to adjust up that limit from the 30% limit?
I'm not even thinking at that stage at this point. We will do that work over the next period of time. And
thinking beyond 2022 here.
As we get towards election 2020, I'm sure we'll have more to say.
Do you have any bias within the range?
Beg your pardon?
Do you have any bias within the range?
Bias within the range.
Between the 15 and 25?
Going down to 15 or up to...
Well, no, as I said in the House on Thursday, what the budget will show is that the projections out to 2032, which is as far as the budget projects, will show that net debt is just under 20%. So that might give you some guide as to where our thinking is at the moment.
If you've had a look at debt, then surely you have had a look at spending and at that 30% figure that's in the budget responsibility rules. So could you please be a little bit more specific about what your thinking is for after 2021?
As I said, I mean, we remain committed to having a fiscally disciplined approach. Clearly all of those factors around debt, spending, surplus do all interrelate to one another, but we'll make final decisions on that when we get a bit closer to the 2020 election.
So when you say you're having another look at these budget responsibility rules in relation to the fact that you now have a wellbeing budget,
well, not right now, we're not. Obviously, they need to run their course.
Election. So what sort of things factor into that new thinking on budget responsibility?
Well, it's just that we now have a budget process where we're looking at a wider set of indicators of success. We're not just looking at GDP growth, we're looking at the success of people and how they go in education and health, our environment, the strength of our communities. All of those things mean we need to take a step back and say, do these rules still work for the kind of budgets that we're producing? I want to reiterate, they will continue to show the kind of fiscal discipline we've showed. And I think it's very interesting listening to some of the commentary about what evidence people might actually have to show that we wouldn't continue, for instance, to have a 20% target. The evidence that we've shown is that we've stuck to that. What we're doing here is accepting the advice that a range is better than a single point target. And as I say, you'll see in the budget that the projections take that out to 2032 as around just under 20%.
What was the Treasury's rationale for the range rather than the target?
Pretty much because a very specific point target may, in some circumstances, I don't believe it has done this, but in some circumstances may lead you to take decisions that are not in the best interests of the overall economic, social, fiscal approach that you're taking. You know, if you're making a decision to go to a very specific point, economic circumstances can dictate that you might want to be in a slightly different position. So the range is merely a mechanism to be able to be more flexible and adjust to those particular economic circumstances.
Adding to that, of course, that given our debt levels are, certainly relatively low compared to other nations we'd compare ourselves to, that rating agencies, for them, it wouldn't matter having that range in that way as well. I'm sure that factored into Treasury's thinking too.
It certainly does, and I mean, bear in mind these are self-imposed rules. They're not written in stone anywhere. The Public Finance Act says you need to have prudent debt levels, and as the Prime Minister is pointing out, our debt levels are relatively low compared to the rest of the world. But a range simply enables the flexibility to respond to the circumstances of the time.
One of the goals of having a BRR in the first place was to stave off the idea that left-leaning governments were fiscally irresponsible. Now, some of the commentary that's emerged in the last week has suggested that goal of proving that you are fiscally responsible has perhaps not been achieved because now that
do you want to tell us why that is, given we're meeting our targets?
Well, I was hoping you'd
I'm
tell
interested.
me.
but that's the very point that I was just making, Thomas, is that I challenge people who are saying, well, this automatically means debt will go to 25%, to tell me what evidence they have for that. The evidence of this government is that for 2 years we've met our budget responsibility rules. The evidence from the last Labor government, when there was a Labor Party at the centre of the government, was that they kept debt at very low levels. So I think people need to take a look at the actual evidence and the actual record and understand that we remain committed to a fiscally disciplined approach. We're simply giving ourselves post-2022 the ability to be able to have a more flexible range.
Will there be any money set aside for the recalibration of Kiwibuild in the budget?
Sorry, there's two things.
Sorry, will there be any money set aside for the recalibration of Kiwibuild in the budget? Or
We're not making budget day announcements today.
Comment on the resignation of Theresa May. Is that going to be lots of work that's now going to be undone?
No, I think the foundation of our relationship is strong and will continue to be strong regardless of who will be in the leadership role in the future. I did pass on personal thanks and also on behalf of New Zealand for the really strong collaboration in the time that Prime Minister May has been in office, because there have been significant issues in that period and our engagement has been really good.
Concerns about depending on who her successor is, how that might impact on New Zealand in terms of trade and so on?
No, ultimately, of course, we will continue to pursue New Zealand's objectives regardless who is in office. I think obviously whoever takes over the leadership role will be very focused on Brexit. There are iterations of that as a whole that are easier for New Zealand to manage or not. It gets more complicated if, for instance, there's a customs union as an outcome, because that has an impact on prospects for a free trade agreement. But again, I don't put that down to individual personalities, but more the outcome of Brexit itself. A hard Brexit would actually be difficult for everyone.
To come back to the budget, number of children that are having to wait months for serious dental care.
Sorry, do I?
Are you concerned about the number of children that are having to wait months for serious dental care?
I want children to have access to decent dental care, and they should. You know, New Zealand has free dental care for under 18s, and that's because when you're a child, your oral health predicts what your oral health will be like when you're an adult. So getting it right really matters. So that free dental care is available. It does concern me if that's not then being met and if that there are long lead times. And that's something that I'll ask the Minister of Health to provide me more information around.
So to come back to the
mental
budget,
health concerns.
capacity constraints have up until this point really hamstrung government spending. So there's, you know, the sort of economy is producing everything that it can at the moment. A way to alleviate that is to increase immigration, to get more people into the economy, to build the roads, do all those things, spend the money that the government could potentially spend. Do you think that the economy does actually need more people to do some of these things?
Look, you know, the way we view it is that we do bring people into New Zealand for this work, and we've just recently, the Minister of Immigration has just recently moved towards more regionalisation of our skills list to partly address these issues, that the capacity constraints vary around New Zealand and vary by sector. And so we need a more sophisticated approach to immigration. No, I don't particularly think it means we need more people coming in, but we do need to make sure that we're getting the right people into the right parts of New Zealand. At the same time, what we desperately need to do is improve the skill levels of New Zealanders and make sure that we have people training in the areas where we need them. And so we're trying to do both of those things, but I don't believe it requires an increase, particularly in the number of migrants. No.
All right, last question, Tova.
Thank you. Should people with acute mental health concerns have to wait at least 8 hours in ED for an inpatient bed?
No.
Will waiting times come down as a result of...
We know we need to take mental health seriously. It's been the strong message of New Zealanders since we took office, and we'll be looking to address that in the budget. Okay, thanks.
So you said previously that you would do a reshuffle after the budget. Have you got a date in mind for that?
No.
Well,